The following segment is sponsored by Grace Internal Medicine.
Dr. Leon Buffalo has been taking care of people in this area for more than a decade, and these days he's getting a lot of questions about the COVID vaccine. He is joining us this morning from Grace Internal Medicine in Simpsonville to talk about it. Good morning, doctor.
Good morning, and thank you for having me.
Thanks for being here. I know people who've already been sick with COVID, they might feel like they already have antibodies. Others who are young and healthy, they may think it's not necessary or that they should wait. Do you recommend the vaccine for all your patients, or what are you telling them?
Definitely. As an internist, my patient population, their age group is 18 and older, and I recommend all of my patients to get the vaccination as soon as possible so we can put an end to this pandemic.
Is there one vaccine that you prefer over another, or do you just recommend folks get whichever vaccine is available to them?
Whichever vaccine available is the vaccination that you should get. We also recommend to our patients to wear their mask when appropriate, socially distance themselves, wash your hands, and to avoid large crowds.
Absolutely. Good advice there. Well, in future segments, I know we're going to get into other medical topics like stress management, diabetes. Right now, let's talk about your practice. Grace Internal Medicine. Tell us about your focus there and the personalized experience that you provide for each patient.
Yeah, the great physician is William Osler. He's the father of internal medicine, and he has taught us as internists to listen to your patients. They are giving you the diagnosis. And our focus here at Grace Internal Medicine is to get to know our patients on a personalized level. And we do that by listening. So we take a family history, we find out where you're from, where you're born, what are your hobbies, because this gives us great insight as to who you are as a person. I like to say that we're treating people, not diseases. And in order to do that, we have to get to know you.
Beautifully said. And your background is incredible. In 1989, you went and served your country as an Army combat medic for 12 years in Operation Desert Storm. On another tour in 1999, you met your wife, who was an Army surgical technologist at the time, and she's now a family medicine physician. Talk to us about the passion that you have for medicine, the passion you have for helping people.
And my passion is prevention through health maintenance, and I love to motivate my patients to take charge of their health. I was just having this conversation with a patient of mine a few weeks ago, and I was trying to tell her that she can come off of some of her medications if she makes some lifestyle changes. And she began to cry, almost tears of relief. And it's really saddened me because I feel like patients have just become accustomed to taking medication, not knowing that they can come off these medicines. Here at Internal Medicine, we offer medical care that's personalized to your need, which means you may come off of some of your medicines if necessary, or you may have to start medicine. But this goes back to our philosophy of getting to know you.
And with that philosophy, you impact so many lives. People certainly love working with you, and you are accepting new patients now. So anybody watching can call the number on screen, 757-5177, to make an appointment. Come see you in Simpsonville. You're at 114B Hospital Drive. Dr. Buffalo, thanks so much for being here.
Thank you for having me.